All right, Jeff, we've been working on your rehab for 3.5 weeks now, so I know things have been getting better. Today we're gonna kind of work on some strength. We're gonna work on the ranges that are still decreased. I know left lateral flexion, left rotation are still decreased, so we're gonna do some pretty hard PNF stretching. I know the area is pretty hypermobile, so we're gonna do some mobs in the area. We're gonna keep working on your core and stability as well as some proprioception. We don't really have to work on cardiovascular fitness because I know you've been on the bike and doing some treadmill walking and stuff, so that should be all right. We're gonna check out your posture and see how that's going. Maybe give you a couple more exercises to strengthen that up a bit more. I think now it's time. I know last time you said you wanted to get into the sport specific, or you started want to get back to squash, so I'll give you some sport specific exercises we can start working on and we'll go from there. So to warm up, I'll just get you to do the neck drills we've been doing. So I'll have you do your yeses in your nose and side to side. We'll do 3 sets of 10 for each range of motion, and this also works on your active range, so we're addressing the flex or range of motion goal as well as warming you up. Go all the way. Okay, there you go. Okay, alright, so lie face down in here. Next, we're going to do some ultrasound to warm up the area the rest of the way and kind of loosen it up, get some blood flow into the area. So, I know we've had ultrasound, but I'll just go over the speech with you again. You shouldn't really expect to feel much, except it will warm up a bit. If it ever starts to burn or if you feel stinging, just let me know. I'll turn the intensity down, and if at any point you want me to turn it off, just let me know and we'll stop the ultrasound. We'll be going for about 10 minutes. We'll have it at 3.3 megahertz, and I'll use an intensity of 0.8 watts per centimeter squared. So I'll just go over your contraindications again to make sure you don't have any. You have no metal plates in the area?
No.
Do you have any infections or cancer?
No.
Do you have any deep vein thrombosis or thrombophlebitis in your body?
No.
Do you have any pacemakers?
No.
Do you have epilepsy?
No.
Do you have any altered sensations?
No.
So I'm going to check the area, make sure there's clean and there's no open wounds or anything. I'm going to make sure it's clean. The towel. I'm going to grab my ultrasound gel, ultrasound head, and gel it up. I'm going to quickly test hot and cold before I start. So just so you know, you can see it on here. This is going to be cold. This will be hot.
Okay.
All right. Tell me what you feel.
Cold. Hot. Cold. Hot.
All right. So do you understand everything? And are you ready to proceed?
Yep.
Okay. So here I got my gel on the ultrasound head. I'm just going to go over the C56 facet for 10 minutes. Okay. It's been 10 minutes. All right. I'm going to sit up. So you're going to sit on the edge of the bed facing this way, and we're just going to work on some isometric strength of your neck. Just when we're doing these, make sure you keep your shoulders, your scapula nice and set like we started working on a couple weeks ago. So we've been doing this for a couple weeks, but I'm just going to push my hand each way, push, push. So we're going to do each range of your neck, and we're going to do 3 sets of 10, holding each rep for 5 seconds.
Okay.
So that's done now. Next, we're going to work on the ranges of motion that are still decreased, so I'll get you to lie down on your back. So I know one was left lateral flexion, so I'm going to use some PNF stretching. I'm going to stretch to the restriction, and I'm going to get you to push into my hand. And relax, relax. I'll push further in, and I'll relax. I'm going to push further into the restriction, and push into my hand again. And relax. We're going to do that, and then we're going to do left rotation the same way. Turn, push into my hand, Relax, I'll go deeper into it. So we'll do that 3 times, like 3 stretches and 3 pushes for each range. You can sit up. And we'll hold each stretch for 30 seconds, and then you'll push no hand for 8 seconds. Alright, so once we're done that, the next one we're gonna move into is I'm gonna combine some neuromuscular control as well as your core stability of thoracic spine. So I'll get you to set your scapula for me. Alright. Next I'll get you to use the body blade, and I just want you to hold it out in front of you and do this for 15 seconds. We'll do 4 or 5 sets of that. Just make sure you're keeping your scapula set the whole time. You can go a little faster than that. So keep the shoulder down. So if you feel the shoulder start to going up, just stop that set and then start the next one. Okay, that's been 5 sets. Alright, so how have your goals been going? Have you been reaching the goals that you've set for yourself?
Yep. Now I just have to get back to squash.
Get back to squash?
Yep.
Okay. Alright. So the next postural exercise I want to work on to strengthen up the muscles back here is I'll find a weight for you. So I'll just get you to lie stomach first on the bed here. I'll find a little dumbbell for you. Oh no, get off the bed.
No.
Like this, so your arm's hanging off the bed.
I won't be able to see that in the camera shot.
Just you can reposition.
You can just hold the camera if you want. Just hold the phone.
That's nice.
Okay.
Like so.
Yeah. So then with your arm hanging off, I want you to set your scapula. So set it back.
Sure, bro.
Okay. So set it back like that, and then pull up on the weight like you're trying to start a lawnmower. Alright, and we'll do 3 sets of 10 like that. And that will help to strengthen all these muscles as well as the postural muscles holding your scapula down. Okay. So you can put your head back in the headrest. So I know that the C5-6 joint is a little face down. Is a little hypomobile, so we're gonna do some PAs and some PA unilaterals, what are they called? Pavum, just mobs to get it moving. So I'm gonna use grade 3 mobs on you. I'm gonna do 3 sets with 2 to 3 beats per second. I'm gonna go for 30 seconds and take 30 seconds rest between each set. Doing a strict PA and mob on the transverse process, so unilateral PAVP, twisting it to the left because that's where the restriction is, so pushing on the right transverse process. Let's loosen up. Alright, so now if we return to sport exercise that we want to get into, so I'll have you take your bat. You can stand up over here for this one. So I'll have you take your badminton racket, and then I'm gonna have you put your squash racket, and it's gonna be like you're running away from the wall. So you're gonna turn towards, look back towards the wall, and I don't want you to go to pain, but just look back, and then turn and pretend to serve a ball back to the wall. So we'll do about 3 sets of 5 of that. So face away, and then look back towards me like you're looking for the ball, and then just take that for 4-hand swing at it. Alright, there you go. So we'll do 3 sets of 5 of that. Okay. So I'll have you do these for a couple days, so I'll have you do those exercises at home, as well as continue doing the stretches and warm-up exercises. I'll let you take this body blade home with you, and you can do your proprioception and core stability exercises. And I want you to do the lawn mowers as well. Add it to your home program, and we'll reevaluate in a couple days and see if you can return to activity.
Perfect.
All
Thank
right.